Often when patients come in for a vaccine, they may also be eligible for additional vaccines during the same visit. So, it's important for pharmacists to be familiar with the safe co-administration of vaccines. First, start with the basics and ensure you have a solid understanding of the principles of safe co-administration. Multiple vaccines can be administered on the same day, with few exceptions. Data has shown similar immunogenicity and adverse event profiles when non-COVID-19 vaccines are administered simultaneously, as compared with being given alone. And COVID-19 vaccines may be administered without regard to timing of other vaccines. When we think about multiple vaccines in a day, patients are generally concerned about overloading the immune system. We educated patients that receiving multiple vaccines in one day is safe and that our bodies are designed to handle it. We also inform patients that delaying recommended vaccines not only increases their risk of infection and the potential for outbreaks, but also increases the likelihood that the vaccine schedule will not be completed. Here are some of the best practices we follow when administering multiple injections in one day. Properly label each syringe with the name and dosage of the vaccine, the lot number, the exact beyond use time, and other important information. Never mix multiple vaccines in the same syringe, and administer each injection in a different injection site. Administer vaccines most likely to cause a local reaction in different limbs, if possible. If this is not possible, we separate injection sites by 1 inch or more. It's important to keep injection sites separate, especially if adverse reactions occur, in order to determine which vaccine is causing the reaction. If vaccines are not administered simultaneously, we follow the CDC's recommendations on timing of vaccines in relation to one another and other products. For example, there is no minimum interval between the use of inactivated vaccines or the use of an inactivated vaccine and live vaccine. However, if 2 live vaccines are needed and are not administered simultaneously, then a 28-day minimum interval between the 2 live vaccines is recommended. There are other recommendations for the use of vaccines and products such as antibodies and blood products. Be sure to refer to the CDC website to obtain specific timing recommendations. The best thing to remember is when your patients come to your practice setting for a vaccine, especially in the fall for their influenza vaccine, ask yourself, do they need any other vaccines? We assess the patient's immunization status based on age, health conditions, and other considerations, and recommend needed vaccines. Then we either administer needed vaccines or refer to a provider who can administer them. Finally, we document the vaccines provided in the appropriate medical record or registry.